Welcome this morning to the Board of County Commissioners meeting for March 17th, 2020. We have 4 of our commissioners on the phone, several of which really wanted to be here in person. But as we are going through an era of a pandemic, we're all trying to practice what we preach about social distancing and getting on conference calls as much as we possibly can. I can't understate the fact that we, as a board, are governing a county in the era of a pandemic. And we really are trying to work together as a region to find solutions and work through this. I appreciate everybody being able to call in today. I have a couple of little announcements here as we go. We will have no public evening comment session today, but we are encouraging folks to write in if they have any comments they'd like to share with the board at this time. I do expect this meeting to be short so that staff who are present and watching can return to critical support services throughout this pandemic. We know that we will have questions, we'll have a presentation from staff. I want to make sure that we all limit our questions to those that are absolutely essential so that staff can get back to their stations and work. So I can't see everybody right now, so what I'll do, I normally would not do this, but I'll probably call on commissioners so that we're not all talking over each other unless there is objection to that.
I have none.
Thank you. We'll start with county administration. We have one item under county administration, which is a public hearing order resolution number 20-03-17-01 in the matter of adopting the FY 19-20 supplemental budget number 3. Making, reducing, and transferring appropriations. And with us on the phone is Christine Moody, our Budget and Finance Planning Manager. Christine, please proceed.
Thank you, Commissioners. I'll just give you a very brief overview of the supplemental. As mentioned, this is our 3rd supplemental this year. The larger things happening in the supplemental are, as you know, we received a renewal of Secure Rural Schools. So the first payment occurs in this fiscal year, so you will see the revenue coming in for that, although those funds are going into reserves at this time until the Commissioners until you have a chance to make decisions on that spending. There is some FTE being added. A couple I will highlight for you is we are adding 2 FTE in the wellness program within Human Resources, and we are adding an FTE for Facility Capital Manager. You'll also see some decreasing expenses in Public Works, especially in the road fund as they figure out the projects that they can complete this year. There's more of them moving to next year, so that's why you see a decrease there. This supplemental is timed to meet the time that we prepare the proposed document for next year, so that we have a chance to look at our revenue and expenses and make sure that flow between years makes sense. And then we do have some funds that are over 10% changing, and that's why we do have the need for a public hearing today.
Thank you very much. Thank you very much, Christine. I'm going to call on each of the commissioners that are out just to see if there's any additional comments before we move to approve. Commissioner Burney.
None at this time.
Commissioner Bozovich.
No comment.
Commissioner Farr.
I have none.
Commissioner Sorensen.
Thank you. I do have some questions for Christine. Number one is there anyone there to make any public comment or testimony about the supplemental budget?
We have one public comment for later, but it does not look like it's for this particular item.
Okay. And then another question for Christine. Did you receive any comments from the public or anyone else about the supplemental budget?
I did not.
Okay. It's not. Excuse me, sorry, I was just clarifying the clarifying the one person that's up for public hearing, and it's not about this subject, so.
Yeah. And Christine, I know that we're going to have the budget sessions coming up, and I'm wondering if there a way for people to listen in on the budget meetings that we're going to be having coming up.
As far as the public listening in, we do, we televise those. Are you thinking more about calling in or like you're doing?
Well,
now?
specifically in relating to this emergency item is that we're trying to practice good policy in terms of not having people come to public gatherings if we can avoid it, and not be in conflict with whatever executive orders are coming down. But we also want to make sure that people are able to participate. And I think one thing is you comment on that people can watch the meetings, and that's good. But in terms of public hearings, for those times when we have public hearing like today, how can people actually testify over the telephone when the board is meeting like this?
So I'm working with Diana Jones. We're exploring some technology to be able to do that. We did already receive some guidance from the Oregon Department of Revenue about the need to have the public be able to give comment in a live setting, either over the computer or over the phone as the meeting's happening. So we are looking into that. So we'll make sure something occurs.
Mr. Mocher, I see you want to add to that.
And
Yeah, thank-
Chair and Commissioner Sorensen, this is Steve Mocher-Heisky. Christine is accurate about that as it relates to the budget process, and I would just add that we are working on a solution for future board meetings that would allow for their public hearings or general public comment for individuals, not only as they always can send in emails, but also to provide verbal testimony via teleconference function. So we're working on those solutions for general board meetings, public hearings, public comment, and the budget process.
Very good. Thank you. Any other questions from the board? If not, I will entertain a motion to approve the public hearing and approval of the supplemental budget resolution 20-03-17-01 as presented.
Chair Buck,
Commissioner Farr,
Was the public,
I move approval.
is there a second?
Bozievich, second.
Thank you.
sorry, this is Christine. Was the public hearing opened at some point? I didn't catch that.
Well, I can gavel in and gavel out real quick, make sure that we didn't miss anybody. I'll gavel in, opening the public hearing. Anybody here that wants to speak regarding the supplemental budget as presented? Seeing none, I'll close the public hearing. Just make sure technically we've got that in.
Chair Buck, I'll reintroduce my motion if necessary.
That might be good, thank you.
I move approval. And I second.
Very good, thank you. We have approval, motion by Commissioner Farr, second by Commissioner Bozievich. All those in favor say aye.
Aye.
All those opposed, say nay. Motion passes unanimously. Thank you. Are there any other adjustments to the agenda? No adjustments to the agenda? Very good. We're going to move on to our emergency business. Thank you. We have order number 20-03-17-06 in the matter of declaring a local emergency as a result of the public health response for COVID-19. I'm going to hand this over to staff for presentation before we have comments or questions from the board. Mr. Mocher-Heisky, start us off.
Thank you, Chair and Commissioners. I'm going to ask Karen Gaffney, who's our Director of Health and Human Services and serving as our Incident Commander for our Public Health Emergency Response in the community, as well as Patience Winningham-Melcher, our Emergency Manager, to provide additional comments for you. But I just want to say that we are here before you today to ask the board to declare a local emergency. You have a draft board order that has been put together and coordinated with both the cities of Eugene and Springfield, and notification provided to our rural partners on this as well. There are some minor adjustments that we would ask the board to make, some Scribner's errors that in your motion to approve, ask you to allow us to make some minor adjustments, including in the now therefore, the second item to say local medical supply resources are being rapidly expended and may be insufficient to respond to this situation as it evolves. So in your approval, if you could just make that note. And then I'd like to turn it over to Karen Gaffney to provide a situation update on our response efforts in the community, then to Patience Winningham Melcher for an overview of the board order itself and our discussions with our city partners. And then Mr. Dingle, our county counsel, is here to answer any legal questions that you may have.
Morning, Chair Buck and Commissioners. I'm happy to provide a brief situation update, and then certainly if there are questions about the situation in the community, I'll answer those as I can. Our numbers in the county right now in terms of confirmed diagnoses remain zero. We have no positive tests in the community. As of the end of day yesterday, we had 81 negative tests and 7 that were still pending lab results. We do get lab results typically twice a day, and we continue to update those numbers. I will tell you that we have seen an increase in the number of tests being run in the community as the private labs have come online as well. So we anticipate that pipeline to continue to increase and get increasing numbers of results each day. But as of end of day yesterday, we still had 0 cases in Lane County. As you know, the World Health Organization has declared this a pandemic, and we have activated our emergency response and activated the County Emergency Operations Center in response to that. We've been working 7 days a week with our community partners to organize a timely and rapidly expanding response as more data becomes available in the community. I want to let you know that there are 3 particular priority areas of emphasis for us right now based on conditions in the community, the state, and the country. The first is absolutely around protecting health, and we've activated our public health staff have actually been working on this for more than a month now to make sure that we're getting accurate information out to our healthcare provider system. Dr. Ludke has been hosting and will continue to host daily phone calls that all of the medical providers in the community are invited to attend and receive the latest data. Our staff are working closely with staff at the Oregon Health Authority and the CDC to make sure that we have the most current information to share with our community and with our providers. We are beginning today, escalating again in response to the governor's announcement yesterday to work on our collaborative system with the hospitals to make sure that in our community and the 5 hospitals that we have here, we're very clear on how supplies will be aligned to needs. The hospitals have been working very hard to make sure that they have surge capacity and ability to expand if cases do start coming in this community, as we expect that they will. So we're grateful for this preparation time that we've had while we still don't have cases in this community. One other primary function for our response system is to provide much needed protective equipment to healthcare providers in the community, and that is something that community is able to request through Lane County Public Health and our emergency response, and we continue every day to ship PPE equipment out to providers and other community, so not only medical providers, but other community providers who need that and request it through our operations center. The other 2 areas of emphasis for us, given the nature of a pandemic and the impacts in the community on the business sector, that is also a priority for our response. As you know, effective today, the governor has made additional requirements on our business community. And actually, earlier last week, we stood up a business response section out of our Emergency Operations Center. Austin Ramirez from the county is leading that section. And certainly if there are questions later, I know he's in the audience and would be happy to answer those. He is working with the Lane County Economic Development Partners Group, for lack of a better name, a group that involves all of the chambers in the county, the cities, nonprofits, community development corporations in the rural areas, as well as our U.S. senators' offices are assisting in that. And others to make sure that we're identifying needs locally for businesses and how we collectively can address those, as well as developing recommendations to state and federal partners. And then the third area of emphasis for us is our vulnerable populations. And I know we've spoken with the board about that. In this situation, we're particularly concerned with people who are over 60, so our older adults, and people who are currently unhoused. And that has been an area of focus. We've stood up a particular section that's focused on that, working with our community partners who are both existing service providers for people who are unhoused, entities like the Mission, St. Vincent de Paul, as well as other less formal, our faith community and others in the community who provide services or are able to volunteer and provide services. We've activated community volunteer organizations in support of that effort, and that will continue to be a significant area of focus. For instance, we've worked with the City of Eugene to station sanitation stations to make sure that people have places to wash their hands, and we want to particularly be equipped in the event that we have people who are ill and need to isolate, that we're able to do that. So we have those plans in place. So those are the three areas of focus for us. And as I hand it off to Patience, I will say one piece of this that's working very well is the collaboration with our city partners. Eugene and Springfield have both activated their emergency operations center, and we're continuing to work collaboratively with them, as well as our partners in the state. So I'm going to let Patience do her presentation, and then we can take whatever questions the board might have.
Very good, thank you.
So trying to social distance and be aligned here. So we are recommending the board consent to this declaration and move forward to declare an emergency for Lane County, following suit with our partners, Springfield last night, as you know, and hopefully Eugene will take the recommendation this afternoon, and it will allow us to reassign staff. We're doing pretty good in getting staff in the room in the Emergency Operations Center to support our overall objectives as they've been aligned by the IC, the Incident Commander. And it also helps identify expenditure authorities and how we can get those sparse resources out into our community and working together with our partners to meet the needs. Karen alluded to the fact that our primary objectives are focusing on business and our mass care efforts, as well as public health. So it's quite the lift for us, and we are operating sometimes 12 hours a day and many days at a time. So I think we're working on 14 days so far. So getting into a really good battle rhythm, and now we're starting to integrate with our cities and get a more coordinated approach. So the State of Oregon Office of Emergency Management is working directly with Oregon Health Authority, and we're doing daily briefings every day at 1 o'clock, and we get a better understanding every day how things are evolving and how we can adapt here locally to meet the needs and the direction they're giving us, as well as identify resource shortfalls, shortcomings, especially when it comes around PPE. So personal protective equipment for hospitals, first responders, and identifying how we can source those resources here locally, if at all, and the capabilities of the state and federal government to fill those requests. It's the responsibility of Lane County Emergency Management to fill all the resource needs for the entire county. So that means every city, every first responder, every hospital is being directed to work with emergency management to fill those needs. And you can imagine that's quite the lift. I'm still kind of a new office, and we're working pretty closely with our partners in the community to make sure we can meet that need. And I feel like it's working pretty well. That could change over time. The governor's office and her direction continues to change, as well as at a national level. So that's what I have for you today.
Thank you. Mr. Dingle?
Chair Buck and members of the board, I thought it'd be a good idea to just give you a brief overview of your emergency authority. And then as we proceed through here, I can answer some specific questions. Basically, the board has three sources of authority to act in the case of an emergency. The first is Lane Code Chapter 20. The second is ORS Chapter 401, which is the General Emergency Management and Service Chapter. And a lot of the authority that the board has through Lane Code Chapter 20 is derived from ORS Chapter 401. And then finally, the board is in a unique circumstance because it is with the abolished, when the cities were abolished in terms of their health authority, the county became the overarching health authority for the board as the Board of Health when it sits as the Board of Health. So those are your three sources of authority. Here, I'm just going to go through and give a couple of highlights from each one of those. And then, like I said, if you have specific questions as the presentation proceeds, I can address those. Lane Code Chapter 20, the highlights are, as I said, the authority is derived from ORS Chapter 401. We are required to send a copy of our declaration to the governor after it's adopted. We have a specific list of powers there at 20.035. I would say that it mirrors very closely the powers and the authority that are listed in 401. There are limits to the board's authority, and I want to make sure that this is clear. I've heard from several sources different things. We are subservient or secondary to the federal authority and the state authority. Nothing in our emergency authorities gives us it specifically says we can't supersede federal law, we can't supersede state law. As a matter of fact, 401 says that the governors, and I believe that the reason that this is done, patients may be able to address this in a more practical sense, but ORS Chapter 401 makes it clear that the governor's declaration and the governor's orders take precedence over the local ones. And I suspect that's so there's not a patchwork of different rules. And as I said, it lists the limitations. There's other things in there that talk about how emergency meetings are organized. And I think everyone members of this board has been through one of our annual reviews of Mr. Mokrahysky's emergency spending authority. We also have under the Lane Code emergency contracting authority, which is also derived from ORS Chapter 279, state contracting law. There's no question that this meets the definition of an emergency, and we adopted in our code the same definition that's in ORS Chapter 401, which is the part that applies here is the human-caused event that threatens life, could cause human suffering or financial loss. I have reviewed the proposed declaration. I believe it meets the requirements of 401-309. It's got, as I mentioned, it lists the powers that that the board has when it acts or when we're acting pursuant to that kind of an emergency. I mentioned emergency contracting authority, and I mentioned that the governor's declaration would and supersede any orders that were issued by the county. And again, nothing in that power authorizes the board to suspend constitutional rights or federal law. And as I mentioned, the last one, which is unique to the Board of Commissioners, is that it sits as the local public health authority. And it may be awkward to the people who are reading this because what happens is that the part that gives the board authority incorporates by reference all of the powers that the Oregon Health Authority has that are listed in 431.143. And it's all the things that you would typically expect that would, powers that you would need to deal with local health emergencies. There's a specific statute that talks about the authority. There's a more specific statute that deals with the power to respond to communicable diseases. There is discussion of the enforcement of those provisions by the district attorney, and the local public official is given the powers of a constable. And again, there's nothing in 431 that would authorize doing things that would violate someone's constitutional rights or federal law. So that's the overview, and I know as this progresses, there's going to be some specific questions, and when that comes up, I'll address and point to the specific portions of whatever statute applies in terms of what the board's seeking to do. And it's my understanding the board is sitting as the Board of Commissioners today and not the Board of Health. So I just want to say that.
Thank you. Any remaining comments? No? Okay. I'm going to ask for commissioners, I'll call you by name for questions. Again, I'd like to limit this particular section to questions specifically about our emergency resolution that we have in front of us. We will have a separate section under county administration announcements where we can ask questions about operational issues surrounding the COVID-19 pandemic. So I'll go by name here again. Commissioner Burney.
I have, first off, would it be inappropriate to start our questions and conversations by moving the order, or would you prefer to wait?
That is fine with me because the discussion hopefully will surround this particular order regardless.
Well, not being able to see fellow commissioners, I hope I'm not offending if I do move that order 2003-17-06 in the matter of declaring a local emergency as a result of public health response to COVID-19 to begin the discussion.
And
Second.
if you could add to that motion to adopt with minor corrections as discussed.
To adopt with minor corrections as discussed.
I'll second that. Thank you.
Thank you. Any discussion, Commissioner Burney?
Yeah. First off, it pains me not to be there, and yet I absolutely now, as this starts getting closer to home, appreciate the fact that that's the only prudent and responsible thing for a high-risk person to do. Secondly, I have no issues with the motion as written and amended, and will vote for it. My questions really relate to the area. So, Chair Buck, if it's okay, I'm going to ask those. Karen or whomever, we all know that we, in all likelihood, do have cases in this community. My question is, what level of testing actually needs to occur for a population of 375,000 or so residents? I mean, how many tests need to occur before we actually have statistically significant data that can be acted upon? I'm just curious how far away we are from that and what that is.
Chair Buck and Commissioner Burney, I'm going to ask Dr. Ludke to come up to the microphone. I understand the question in terms of amount of testing that would be ideal for our population, and I know certainly there has been a lot of concern about access to testing, so I think that that's a reasonable question to talk a little bit about testing. Pat?
Well, thank you, but there's even more of a context for me, and that is I don't think we have a clue where we're going to be in 2 or 3 weeks. And so I'm just trying to understand the ideal, because obviously we need to move from where we are to that ideal at some point.
Doctor, before you respond, I just want to remind folks that are speaking at the podium that we do have disinfectant wipes right there if you wish to wipe down before or after you're speaking.
Thank you. Chair Buck and Commissioners, and Commissioner Burney in particular, I appreciate the question. Dr. Patrick Ludke. I guess I'll take issue with one of your comments, which is we have no idea where we'll be. I think my issue would be that we have an idea where we could be. The challenge that we have is we know a worst case scenario, and a best case scenario is no cases, and the most likely scenario is neither one of those. So that's the challenge. And the broader part of your question as to how much testing do we need more testing we have currently. I think there is general agreement both in the lay public and in the scientific community that that is a true statement. And we are approaching a time where we are able to ramp up testing more significantly. I am unsatisfied with the level of testing we have presently. We have 4 laboratories serving our community at present, able to provide testing, but at very limited amounts. Another comment I think is worth making is that the data we have so far initially from China and now moving to some better data from Western Europe, including Italy, shows that roughly 80% of these infections are asymptomatic or mild. Certainly those people do not need to be tested. And when you have a condition where there is no vaccine and there is no treatment, what is the benefit of getting a diagnosis? It's limited. So if you test everybody and they all have coronavirus, what are you going to do anyway? You're ruling out other possible diseases that may have treatments, and that's of benefit. But to the 80% or more who are asymptomatic or have mild disease, there is really very little benefit for testing at all. So our true testing volume need is probably significantly less than the general public would imagine we need, but we're nowhere near at that point yet. I hope that addresses your question.
Oh, hey, Dr. Leckie, it addresses it as good as anyone could. We're all kind of shooting in the dark here. I would also like to state that in the presentation, was discussed how Lane County Economic Development Partners are identifying needs, how to address locally and make recommendations to state and federal, and I think that's a good model. I remember in Santa Cruz County in 1989 after an 8.1 earthquake where we were completely isolated and the National Guard came in. The chambers the area chambers of commerce economic development committees quickly transformed into economic support or economic and earthquake support. I mean, they completely transformed the direction of their infrastructure, which brings me to just a further comment. And I think maybe some of you have seen this. I really believe that that the collaboration that I've seen and was mentioned between Lane County, City of Springfield, and City of Eugene, coordinating and collaborating is absolutely remarkable. And I commend us, not us as commissioners, but us as a county with staff and those other cities and our rural partners for that. And I mean that sincerely. Your mobilization far exceeds anything I saw in that earlier incident that I discussed. My sense is, in addition, we are also getting emails and comments from people that have other concerns that go beyond this emergency declaration. Things that relate to, like in Multnomah County, I don't know how they're doing this, but a moratorium on evictions. Things in this county that relate to producing enough disinfectant soap, because apparently there's a real demand for that. Other areas of doing driving and shopping for the most vulnerable of our populations. And so I simply want to, in enthusiastically supporting this declaration, also request that we in the county also look at how we can support natural, informal networks of support where neighbors are helping neighbors. They are being mobilized. I don't know if there's a role we can play to coordinate and expand and encourage that, but I think that's going to be the next level of resiliency that we will be forced to deal with. But having said that, Chair Buck, that's the extent of my comments at this point.
Ms. Katz, sorry, I know none of the rest of the commissioners are here, seeing that Chair Buck and I are making eye contact. So I appreciate, Commissioner Berney, those comments, and specifically on the business side, I think we'll have Austin come up and talk a little bit more about that. And while he makes his way to the microphone, I want to underscore your comments about those natural supports in the community and absolutely acknowledging that this is about a community need and community coming together. And as government, there are certainly some things that we can and must do to support people getting the health care they need and the materials they need and supporting recovery. And that's never going to take the place of what it means to come together as community and those natural supports. I know there have been Facebook groups forming to help organize that. We have a particular coalition that's part of our regular standing Emergency Operations Center that we activates and we actually invite them into our Emergency Operations Center to help coordinate with the community and those natural organic community supports that happen. And so we often talk about the unintended consequences that happen from things. And I think to the extent that people are coming together, that's actually a positive unintended consequence in communities of support. So yes, we are helping connect individuals to those organizations. And I might take this moment to just do a plug again for if people have questions or want to access those resources, there's a couple easy ways to access that, to send an email to corona-info@lanecounty.org, and that email comes into our staff to be able to triage and help connect people with resources. And then we also do staff a call center from 8 a.m. to 8 p.m. 7 days a week. And we have people there who can answer a host of questions from individuals in the community. And that number is 541-682-1380. So with that, if Austin maybe can take a few minutes to give a little more detail about our work in the business community.
I'm just going to ask right before you start, Austin, if the commissioners on the phone could make sure that their phones are muted unless they're talking, that would be great. Thank you. Go ahead.
Thank you. Good morning, Chair and Commissioners. I wanted to expand a little bit on what our efforts look like with the business community. So before the governor's declaration on modified service for businesses, we had been providing daily updates to regional solutions at that point to help inform directly what impacts we're facing locally and what our businesses need not only now, but in the long-term recovery process. And now that they've officially convened the Economic Advisory Council, each regional solutions coordinator is responsible for convening regional recovery teams. And so what that looks like here is we've convened over 80 of our economic development partners from throughout the county electronically. We've all seen patterns in what the issues we're working on are. So currently that is a centralized business resource list, metrics and analytics in the short term and the long term to measure the impact, broadband continuity, especially as folks work remotely and communities start social distancing, local policy options, legislative regulatory barriers, and short and long-term recovery strategies. And so it really is an all hands on deck. What we've been advised by Regional Solutions as the most effective thing to do is to be that funnel and provide them with collective and focused information so that they're not receiving it from hundreds of people throughout the county. And so anybody who has ideas or wants to contribute, it's a shared Google Doc essentially, and so we have a lot of partners working on that as we speak. Any business with a business-related inquiry can send that to LCBUS concerns@lanecountyor.gov, and so we are, as we expected, being inundated by requests from businesses, everything from what they can do to modify service delivery to how to implement social distancing or just to find resources. For a lot of our smaller communities and the unincorporated, that sort of digital resource space has been really critical to help guide them to what they can do to responsibly encourage folks to shop, what local policy changes they can make, and what recommendations they can start making to their communities. Overall, I would just remind our business community to please be mindful of their own health as well as the health of their customers, and please exercise that social distancing seriously. And at this point, we are all responsible for the health of our community. So for a lot of our small businesses and entrepreneurs especially, this is a really damaging time. It's really difficult to get through, but following the advice of our public health officials is the most important and effective step we can all be doing at this point.
Thank you. Commissioner
So I'm going to start out by suggesting an amendment to our declaration. Our declaration is split up as most of our similar declarations have been, with a bunch of whereases stating the situation that justifies what we're doing, and then a therefore as to what the board orders. And item number 2 under the therefore is actually a statement of the situation, not something the board is ordering. So I suggest that we take item number 2 under the therefore and convert it to be a whereas, and insert it after the whereas that starts out whereas school closures. So it comes before the whereas that is whereas COVID-19 response, and that way it's ahead of all the statutory citations, et cetera. But it's really just one of the reasons why we're declaring this emergency. It is not something we are ordering. We're not ordering the local medical supply resources are being rapidly expended. You know, so it's clearly not something we want to be, you know, passing a motion and looking like we're ordering any sort of shortages as the situation evolves. So I would move to amend the motion to move the second therefore up to the whereas, as I described right after the whereas that starts with school.
Well, actually, as the maker of the motion, I want to say that I accept this friendly amendment.
Mr. Murkowski, you want to add?
I just want to say that staff and legal counsel have reviewed that request, and we think that's appropriate.
As seconder, I accept that as a friendly also.
Great. So we have a motion on the floor from Commissioner Bozievich, second by Commissioner Sorensen. Any discussion on that particular amendment? Hearing none. We'll go.
Madam Chair,
yes.
we don't need a vote.
On the amendment to the motion?
If it's accepted as a friendly, we don't need a vote.
Okay, it's a friendly. Good.
And the maker of the motion and the second of the motion have accepted it.
Very good. Thank you. So, Commissioner Bozievich, do you have any other questions or comments on the emergency clause?
No, thank you. I just want to say that I really appreciate the work that staff has done under this situation, stood up our incident command structure immediately, and have been working hard on trying to prevent the spread in Lane County, and taking this whole thing very seriously. I also want to say that our community is really pulling together in many different ways. Like some people have said, they've seen Facebook groups where people are volunteering to get groceries for elderly folks that are at risk. This is really not about whether we're, Republican or Democrat, where we live or whatever. This is something we all need to pull together to get past and to help make this not be more serious than it could be. We don't want to end up in the way that Hubei and Italy have ended up. If we take seriously the steps and work with folks to prevent the spread of this virus, it's really an important preventative and will ultimately be the most long-term resilient thing for us to do. And I really support this emergency declaration and the work that our staff has been doing.
Thank you. Commissioner Farr.
Thank you, Chair Buck. I'd like to thank Vice Chair Berney for asking the questions that triggered staff response that answered many of the questions that I would have had. So thank you, Vice Chair Berney, for that, and thank you to staff for those responses. I only have two things. I'm not going to bore you with my emotional, I'm not going to indulge myself with my emotional responses and how I feel right now, but what can we do as a county? There are two things that I'm going to point out. Commissioner Berney points out that we're shooting in the dark, and as a matter of fact, in some areas we are. But like all situations, we have to minimize the areas that we are shooting in the dark, and I strongly believe that staff has done a superb job of minimizing areas that we're shooting in the dark. Dr. Lidke's response regarding where we're going to be 2 weeks from now being a range of places we could be, at least we have that range that we are looking at, and I thank Dr. Lidke for that. You know, we're taking control of the things that we do have absolute control of. We're identifying new things that we can have control of, and we're coordinating our efforts in things that we have partial control of. All of that allows us to be responsive to the things that we don't have control of and consolidating our resources in order to do that. I trust that staff is doing that. And the reason that I can say that is last week I observed from a great distance. I was in Ohio watching every move that staff made, every move that I could possibly watch, and I was highly impressed with the organization that has taken place and the response that we are formulating and delivering. Thank you for that. That's my first item, and that's the least important. My second item is something that's not really covered in the order that we'll be passing in a few moments, and that is not the business response, Mr. Ramirez, but the response of the people who work for the businesses. Last night, a lot of people in Lane County were laid off, and people who are earning the lowest wages and thereby at the closest level to losing their housing, the closest level to not being able to make rent and other essential payments, those people have been laid off. And we don't know when the end of that is in sight, and we don't know what we can do as a county. But my question that doesn't need to be responded to right now because it's a long-term question is how do we make certain that we are not contributing to our, and this is a very raw question, to our already exaggerated numbers of people who are living homeless. People who are living close to the edge, missing rent payments, are potentially going to be thrust into homelessness. That's not a part of this order, but it is has to be a part of our county response. There are things that we can control, and we need to identify the things that we can control to help people to maintain and sustain their existing way of life. Once again, I'm not going to go into my emotional feelings, but I'm thankful that staff is on top of it. I had a chance to see what is happening in a different state, and by and large, the makeup of Lane County and the makeup of the state of Oregon seems to be far ahead of what I've witnessed elsewhere. That's all I have to say at this point. Thank you, Chair Buck.
Mr. Murkowski, do you want to add to that?
Thank you, Chair and Commissioner Farr. On the first point about business activity, I'll just make a couple comments. One, in addition to what Mr. Ramirez shared with you, we are actively coordinating with the chambers, both in the metro area and our rural partners, on ways in trying to understand. I think Mr. Ramirez touched on the survey that is happening of businesses, and we're trying to understand what the needs of businesses are, and then the ways in which the county and the cities can be partners in helping to support business needs going forward. The business of Lane County is continuing. So I will share a more in-depth update after this item to talk about county business operations and adjustments we're making, really a balancing act between making sure that we're keeping our employees safe and healthy and the public safe and healthy, but in terms of creating the separations and the social distancing that has been recommended by public health officials, but also recognizing the reality that Lane County and other local public agencies provide critical services to the community that can't be stopped because the community relies on the services we provide. So I just want to, from the standpoint of how we're operating and then the impact that that has on local businesses and residents, we are continuing our operations and the services that we're providing to the community, the contracting that we have with businesses, but we are adjusting the way in which we provide those services so that we're keeping both the public and our employees safe. And then on the second point related to homelessness response, there's been a significant amount of work, particularly through last week and through the weekend in partnering. We had a meeting last Thursday evening with a number of our shelter providers, St. Vincent de Paul, the Mission, as well as the faith-based community. Chair Buck attended that meeting to talk about coordination of services to our unhoused populations. We worked through the weekend, and as many of the faith-based communities pulled back from the Egan Warming Center operations, understandably, because of the impact not only on their facilities, but their volunteers, many of whom are elderly, Lane County stepped up to allow the use of 2 facilities at the Lane Event Center to be used over the weekend during the freezing temperatures. We further worked with our service providers and others in the community to identify ways in which we could isolate people, and particularly individuals that were exhibiting symptoms, have food delivered and other things in response in the moment to issues that were happening there. We continue that coordination. I'll give an example that we're working with St. Vincent de Paul on the dusk to dawn model and shifting to now a dawn to dawn model for a period of time going forward so that we can keep individuals that are in that shelter location there and have food service brought to them there, as opposed to congregating in other large areas. So I know Ms. Gaffney can further expand on the coordination effort, but I just wanted to make a point that we know that both Lane County and our partners at the cities of Eugene and Springfield, as well as our nonprofit service providers in the faith community, are a key part of helping to keep safe and healthy our most vulnerable populations in the community. We're actively working on that.
Thank you, Mr. Mokrohajski. Chair Buck, a brief response, and still in my queue, if I may.
Sure.
And Mr.
Just
Mokrohajski,
Oh, I'm sorry, Commissioner Farr. Karen wanted to add to that too. I'm not sure if
Thank
you
you.
want that before or after your additional comment.
mine will be very brief, Ms.
Okay.
Gaffney, if you don't mind, and maybe you can address a part of this brief response. Ms. Mokrohajski, I do understand that we are maximizing our efforts on existing homeless, and a part of my point is not adding to the numbers of existing homeless by helping the people who are currently laid off. I spoke to a local restaurateur this morning who has laid off staff. They don't have jobs. And here's something that we can potentially do regarding that, and that is they are all petitioning for unemployment right now at the state, and they can't even get through to the state to sign up for unemployment. So we can petition to the state to open up their lines and maybe put more resources into accepting unemployment claims at this point in time, because people aren't getting through. That's just one way. And the second thing I will say is regarding not just the people who are laid off, but the people who are working for Lane County. Mr. Mokrohajski, you and I talked a little bit yesterday, and I expressed my interest and my desire in making sure that people who work for Lane County do not have shortened paychecks based upon emergency needs that their families may have during this period of emergency. And I know that you and staff are working on ways to make sure that does not happen, and it remains high on my list of priorities. Our staff should not have shortened paychecks. Thank you.
Yes, and I'll touch on, I just don't want, there's a lot of information related to workplace and employee adjustments, and I want to save that for a different, after this item, so that the board and staff can focus right now on the community response. But I definitely will dive into the workplace and employee changes that we're making in a bit.
I understand. Thank you for your indulgence.
And Chair Buck, Commissioner Farr, I want to follow up in terms of the community emergency response piece of what your question was, and absolutely underscore the first part of your comment about making sure that not only that we don't have that we can mitigate the impacts on people who are currently homeless, but that we also do everything we can to keep people from falling into homelessness. So that's absolutely on the radar for us. And a piece of that specifically anchored to your comments about new layoffs that are happening in response to the downturn in the business environment in this community. We are working closely with state and federal partners at both levels. There's a whole lot of work happening about what can be passed in communities to help buffer people during this emergency time. And so both through our contacts with the state and our work, we had a call yesterday, for instance, with Representative DeFazio's office, and I know that our Senate delegation has been keeping us informed about those efforts as well. So we're tracking on resources that will be available to individuals and employers through both of those mechanisms, and make sure we get information out to community. There's a piece for us as the local emergency response that does provide an ability to funnel information to people. So for instance, I appreciate your comment just now about individuals in the community who are having a hard time getting through to the employment division. And so those are absolutely the things that we can help troubleshoot. And I noticed out of my peripheral vision, Patience was writing that down while you were talking as well. And if people have those concerns, it's a really great opportunity to just flag them either through our email or through the phone call in case it's something we haven't heard about, and then we can also help facilitate those communications. I do anticipate that through both federal and state legislation that there will be opportunities for us to help buffer some of the economic impact on individuals through this. So we're tracking that, and we absolutely need to mitigate the impact of this emergency on the people who are currently most vulnerable in our community and who are unhoused. So we continue to work with our shelter and service providers to make sure that they're able to provide their services in the way that best protects the health of their staff and their clients, and we continue to work with them to provide materials. And as the county administrator mentioned, a specific example is our work with St. Vincent de Paul to make sure that we can shift to a dawn-to-dawn and ensure appropriate social distancing as they can in their facilities to protect health.
Thank you, Ms. Gaffney. Your presence and your words give me comfort that I can pass along to people who are asking me questions. Just another point that I will make, a lot of restaurant workers have been laid off, not because of business downturn, but because their place of work has been closed. Those people have emergency, immediate needs, and in addition to the people whose businesses will suffer downturns. So that is as an emergency and immediate need. Thank you, Ms. Gaffney. Once again, your presence and your words give me comfort.
And before we get to Commissioner Sorensen, since we are talking a little bit about services for St. Vincent de Paul and Dawn to Dawn, I just want to reiterate my potential conflict of interest since I am related to the executive director, although I don't believe our discussion today is an actual conflict of interest. Commissioner Sorensen.
Thank you very much. I have a couple of specific questions for specific staff, and I'll just start out with Karen first, but I do have other questions of other staff. In the proposed emergency order, there's a reference, and we've already moved it from the ordering part to the whereas part, and it talks about medical supplies being in short supply. I'm wondering if if you favor including food as well as medical supplies, because I understand there's also shortages at stores for food in Lane County, and I think we should recognize that food is being limited in Lane County, and I just wanted to know if you had any update on that and your view on whether you would oppose or favor including food as part of the reason for the emergency declaration.
Thank you, Commissioner Sorensen and Chair Buck. I was just asking Patience if she had specific information about grocery stores being short on food. We have not heard that. Certainly, there have been concerns around some other supplies. You know, lots of social media is talking about toilet paper, for instance, and hand sanitizer. And I believe the supply chains are moving to restock those, and lots of messaging has gone out from all levels of government asking people to really just take what they need and not hoard. And so, and I know the governor referenced that in her remarks yesterday as well in terms of ensuring that we don't have price gouging and other impacts on that system. So I have not heard of shortages of food in grocery stores. I know there have been concerns, and perhaps this relates back to what Commissioner Farr's question was in terms of some of our most vulnerable people, is whether our food banks have capacity to help people who may need food assistance, and some of those people might be new to needing food assistance who didn't need it in the past. And Austin, in addition to doing the work he's already described, has been reaching out to our food banks to make sure that they have what they need, and if they need support through our EOC, that we can assist them with that. And I don't know, Patience, do you have anything to add?
Sure. So there's actually a lot of movement afoot in this field. So specifically to the grocers, they have, I think it was either yesterday mayor today, the grocery chain is having a conference call at the state level to talk about impacts. And a lot of what I've heard is it's actually impacts to their staff. So staff that the kids, there's no school, so they can't come to work. So their stockers are in limited supply, so they're having to adjust their schedules to be able to get the food on the shelves. ESF6 or Mass Care and the Food and Water program at the state level are looking at the food banks and their capacity to provide food to our communities because, again, the schools are closed, people aren't being able to go to work, and what are the potential ramifications or impacts to the food banks across the state of Oregon. And they're working with the food banks right now to determine, do you have enough volunteers to get the food into the communities, to truck it around the state of Oregon, and then how much food do you have in supplying your community, and the potential outfall and unemployment for our community as well across the state of Oregon.
So you don't think that it's necessary to include a concern about food in the whereas that as far as you're concerned, the food situation is okay, and even though, in my view, thousands of people are being laid off and they'll become food insecure pretty soon, I'm trying to understand your perspective that you don't think food should be included in it.
Chair Buck and Commissioner Sorensen, and I'm looking at County Council if he disagrees. I'm not at all saying that food is not an important concern to people living in communities, and there may be individuals where that is an impact. I guess my sense is in terms of our declaration, this will be an evolving emergency, and our intention was to write this order in a way that it activates your emergency powers under Lane Code, and it gives us the flexibility to respond to whatever the changing needs are in the community. So if that were to become a significant area where we needed emphasis next week or next month, we would have the capacity to do that under the executive or under the declaration as it's written. Is that correct? Mr. Dingell.
The declaration here is just talking about the general declaration. The board would have to come back. I mean, if I went through and listed all of the different things that the board could do, that would require additional board action. You can, for example, ban the sale of alcohol, limit the sale of gasoline. I mean, there's just a limit, but those all require a separate decision to come back from the board. In my opinion, I don't think it's necessary to include this in the initial general declaration. To be able to do it later.
Do you have any other? Oh, yes,
Yes,
Commissioner Sorensen.
I'm not done. Thank you so much. Mr. Dingell, I have a couple questions for you. Just wanted to confirm this. It looks to me pretty clear, but just wanted to confirm this, that the emergency declaration can be revoked within the 60-day period by meeting of the Board of Commissioners.
Yes, if first of all, the declaration has to, by statute, have some ending date. And so, yes, if the emergency is declared or the circumstances arise where the emergency disappears, then yes, it can be ended prior to the 60 days. And by the same token, it could be extended.
Yeah. And secondly, there's no revocation of assembly rights or the elections that are scheduled. There's no revocation of any of those rights that are ongoing for voter registration, elections, or assembly rights under the Oregon and U.S. constitutions.
That's correct.
Yeah. Okay. And now to Mr. Mokrahajski. In the emergency declaration, there is a authority to spend up to $750,000. Could you give the board and public an idea of what you would need to spend that money for, and how you currently anticipate spending $750,000, and where will that money come from?
Well, I will just generally say that the declaration is intended to allow the flexibility. That's the whole point of this declaration, is to allow the flexibility, because the administrator's authority is $150,000 for a particular incident, and that can get expended very quickly. I will give you one example. I authorized over the weekend an additional expense for moving the dusk to dawn function to a dawn to dawn, and that comes for 30 days. That comes with an additional expense. So and I'll ask both Karen and Patience to elaborate on additional needs that are coming through the incident command structure in our emergency response. But these would be either contracts with nonprofit or service providers for various needs, or other services or supplies.
Chair Buck and Commissioner Sorensen, actually the county administrator used the example that came top of mind to me because it happens to have been the largest dollar amount example we've had so far. I would say other expenditures can be for materials and supplies. If we, for instance, we talked about hand washing stations. If that's something we would need to rent or purchase, that would be part of an expenditure. Short-term contracts or purchasing tents to set up auxiliary buildings might be examples of expenditures that would come through. I don't know, Patience, if you have any other typical examples.
I think that you hit them all on the head. We may get into a situation where we do have to buy PPE if we can find a source locally, personal protective equipment. I think that hopefully that comes to fruition. I'm working on that right now, but also our staff time. So I mentioned earlier that our operational periods have been sometimes 5 days a week, 8 to 5, sometimes 14 hours a day, and we're pulling in staff from all over the organization to support the effort. I think right now at last count we have 35 to 40 people working on this, and in the Emergency Operations Center, as well as on public health and communicable disease and across H&HS, which is important. We could also take advantage of these funds to meet the needs of our communities. So the social service aspect, we already spoke to, the hand washing stations, but Dr. Ludke had alluded to it could be 0 cases. It could be what we're seeing in other countries, and we have to look forecasting to where that meets in the middle. So there could be lots of things that we could anticipate seeing in our community and being able to lean forward on that. So sheltering, what does that look like if some of our social services are impacted and they have limited volunteers to come help some of our homeless population shelters, and how can we reassign staff? And the list could go on and on and on. Mm-hmm.
Yeah. Could you address the issue of where is the money coming from? In other words, why wouldn't we want to say that the county administrator had $750 million of authority? What is the reason? What's the reason that $750,000 would be used, and where is it coming from? In other words, I get it how you're going to use that authority beyond the current authority of the county administrator, but I'm still not understanding where the money is coming from.
So Chair Buck and Commissioner Sorensen, the money will come from various sources within the organization and ideally at the state and federal level. So there's not one specific source, but what we are doing as part of our ICS structure and emergency operations work is tracking all of these expenses. So Patience brought up the staff response. We have 3 different time codes that we've identified for county staff to track time for any time that staff is spending on COVID-19 community response. We're tracking all of those expenses. Some of those are fixed costs. They're not new. Some of them may be new because it could be overtime that is being spent. Regardless, we want to track staff costs that are fixed or new and other real costs related to our response. Again, the resources for which will come from various sources within the organization and the community and outside the community. And then our plan is, and part of the purpose of the emergency declaration is to ensure that we are able to receive reimbursement for as much of those expenses from the state and federal government through their emergency declarations and through funds that they are making available, so that the costs that the county and its partners are spending in our community response, as much of that will be reimbursable as possible. So all of this.
Yeah, go ahead, finish, I'm sorry.
I just wanted to put a nail in it that all of the costs are going to be tracked, and the impacts to the costs will be clearly identified and accounted for, and we can report on that. But I can't give you an answer right now because I don't, it's going to come from various sources. And our focus, frankly, right now is responding to the community needs, keeping our employees safe and healthy, and responding to the needs of our residents and most vulnerable people in our community.
I would like to add that, just one point, Commissioner Sorensen, I just want to add that we are running past the hour, and some of these folks sitting here need to get back to their emergency locations, mainly the incident command. So if you have any other urgent questions, see if we can get that out.
I do have an urgent question, and that is, Mr. Mokryski, with regard to the $750,000, are you going to be making changes in the budget, the adopted budget from the Board of Commissioners, and then the recent order we did this morning? Are you making changes in the way you're spending money than what was adopted by the Board of Commissioners?
Well, you approved a supplemental budget, which is changes, various requests that come from departments in the regular course of business. I believe we do 3 supplemental budget amendments every year, and that's a recognition that a budget is a fluid planning document and things are going to change. So what the action you took this morning was sort of a regular, a typical practice of amending the budget based on general operational changes. Our response to this, there will be funds, there are being funds expended that we didn't account for as part of the budget when the board adopted it last year, or that were identified in the supplemental. Again, we're going to track and account for all of those expenses. We can provide reporting to the board and the public as we move forward on all of that. And then as it relates to the development of next year's budget, yes, we will, as much as possible. We're currently developing the budget for next year. So as much as we're able to, we will reflect on the information we have available and make appropriate adjustments as necessary. But I think everyone appreciates that this is a very fluid situation that is changing by the day, if not quicker. And Mr. Dingell just handed me additional information. You know, the only other thing I would say here is that you referenced the $750,000 number. I think, you know, we certainly will be prepared to come back to the board if and when we exceed that number and ask for additional authorization. But I would say, you know, there needs to be public accountability here too. So you don't want to give endless authority to spend money. I think it's responsible for the board to say, let's go to 750. And then when we expend that or get near to it, we will come back to the board with a reporting on the information we have and how those funds have been spent and ask for additional authority.
And if I can,
I think all of that is quite reasonable, and I appreciate your response to my questions about where the money is coming from. And I would just make a suggestion, and it's not even a request, it's more of a suggestion, that if you're able to send the board emails about chunks of money within that $750,000, that it would keep the board aware of the amount of money that's being spent as the 60 days commences today. And I also want to finish by saying that this is a tremendous challenge for our community, that the people that are doing the work, including you, Mr. Mokryski, as well as all the other staff and volunteers and elected officials in the community, just a tremendous lift of activity. And I really appreciate all the hard work that's going into this. And I want to also state my support for this emergency declaration. And finally, I'll just issue my reserve on the topic of testing, that less developed nations have substantial testing underway. Developed nations have more testing going on than we have in our community, and I don't understand why we don't have more testing so that the people that will apparently not get this disease can be informed that they're not getting the disease. and that the people that are getting the disease can be separated for treatment and be identified for treatment, and that my constituents are very upset, if not angry, over the lack of testing in our community. Thank you very much.
Chair Buck, just very briefly to reassure the commissioner and the public, with the emergency declaration under the Lane Code, there is a delegation of authority to the county administrator to essentially move funds around to meet with, or to deal with the issue, and it requires him to report to the board on how that money is spent.
Very good, thank you. On the very last comment, which is a very reasonable and rational issue, Ms. Gaffney, do you want to address that as much as information that you have?
In terms of the testing?
Yes.
Yes, and thank you, Chair Buck and Commissioner Sorensen. And I would say that we share your concern about the fact that there is not the amount of testing we want either, and that's certainly what Dr. Ludke said in his comments. The capacity to provide those testing kits is something that local public health does not have. That's not our role, so we absolutely are supportive of the private labs coming on board, and I'm glad that the CDC is opening up testing opportunities more, and that we want to make sure that with the testing capacity we have, that the people who need it the most are getting tested, and we continue to work with our provider community to prioritize the tests that we have for the people who need it the most. And as more testing kits become available through that federal system, then I expect that there will be more access. It may not ever be that anyone, anytime who wants a test has the capacity to do that. We want to make sure that labs are able to run the results for the people who are ill and get us that information as we're moving through. But please know I'm also hearing concerns about testing, and that's a piece of why we asked Dr. Ludke to address that up front, because I know that that's a very real concern in the community.
Thank you. I just want to add a couple of comments. I want to express my extreme gratitude with the collaboration we've been having with the City of Eugene and the City of Springfield. We truly are, as a region, trying to address this as fast as possible and as thoroughly as possible, given the speed and the rate that this transmission is happening in our community. I've been here at the county with staff full-time, and I've been on calls with the governor's office, with mayors and other chairs of commissions around the state several times in the last few days. A lot is happening, a lot of modification to procedures. It's moving, and we struggle to keep up at sometimes, but know that every effort by every worker in the county and in the cities is doing everything possible that they can to get that information out to people and to work collaboratively as much as possible. We have outstanding staff here at the county. I want to thank specifically Mr. Mokryski and Ms. Gaffney and Dr. Ludke and patients. All of you have been doing a phenomenal job, and I know that there's a lot of people supporting you in this. And I know that you've been going weeks at a time without any break at all, and that's hard on people. So I just want to remind you, as well as people out in the community, that even though we're on this trajectory with this pandemic, you need to take a moment for yourself just to gather your thoughts, because we need your effort, but we don't want you to hit a brick wall at the same time. So take those breaks when you have a chance, and know that I hope I can speak for the rest of the board, support you 100% in everything that you're doing. We will get through this pandemic. There will be a time when we'll be on the other side. It feels like we're in the beginning, and we've got a ways to go, but we will move through this as a community. And when we take into advice about hygiene and social distancing together as a community, when we follow those instructions, we save potentially thousands of lives in our community and beyond. So it's extremely important that these guidelines from both federal, state, and local be followed as closely as possible. With that, I will call for the vote. I just want to make sure that I have this motion stated properly
Well,
with the amendments.
Chair, before you do that, may I, Commissioner Burney, make just one comment?
Please.
I want to say that in my brief lifetime, in the businesses and other entities I've been involved with, the buck usually stops at the top. I think that in this instance, the buck stops here at the bottom, where people live, where businesses do their commerce. And so I want to also, following Chair Buck, applaud the transparent conversation that commissioners have had. I mean, really, truly, we have voiced our critiques, our concerns, our support in front of everyone without edit. And the no-nonsense recognition of this as an emergency by county staff who are operating appropriately and forthcomingly. I just think the fact that we live in intensely uncertain and critical times, I think it's reassuring to our neighbors that we as a group and other entities can recognize this for what it is, do our best. And I really believe that I think both Commissioner Bozovich's reorganizing of the resolution is exceedingly appropriate. And I think Commissioner Farr's points that to the degree as we work through this, because this is going to continue, that we can reassure our neighbors that there are plans to make sure food supply is not interrupted, medical supplies for the most infirm among us are not interrupted, that there's some stability of shelter, that even, that everyone can count on, not just focusing on homeless, obviously prioritizing that, but even renters that have been laid off of work and are a paycheck away of not being able to pay their rent, or homeowners with their mortgages, some sort of stability, all of those areas. So I just really appreciate and support this Board of Commissioners and our staff, because the buck truly stops with us. And thank you for the opportunity to speak, Chair.
Very good. So I'll try to restate our motion with the amendments that we've been adopted. We have order number 20-03-17-06 in the matter of declaring a local emergency as a result of public health response to COVID-19 with adoption of minor Scribner's changes as discussed by Mr. Moker-Heisky, and the modification of item number 2 under therefore moving up to a whereas. Is there anything else that I missed, commissioners, in that? Hearing none, I'll call for the vote. All those in favor say aye.
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 All those opposed say nay. Motion passes unanimously. Thank you, commissioners. We'll move on to public comments. We have 2 people for public comment today. Mike McFadden, if you could please come to the podium. You have 3 minutes. I'm going to try to do double duty here with the minutes. Please state your name and your district, and I'll go to 3 minutes for you. Thank you for coming.
You're welcome. Thank you. Good morning. My name is Mike McFadden. I'm from Eugene. Commissioner Sorensen is my commissioner. And, to start off, I would like to also say thank you to all of the public employees who are working so hard during this time to provide critical services to the community. The reason why I came in this morning really has to do with, the concurrent economic emergency that's going to be taking place, that's already taking place, with the public health emergency that you all just declared. Commissioner Farr, I really want to thank you from the bottom of my heart for the issues you raised this morning, and Commissioner Burney, I also want to thank you as well. There are thousands of people who are laid off, not just in restaurants, but in a myriad of businesses all across this county. I already know, a few single mothers in my own personal circle of acquaintances who are making the decision whether or not to meet the needs of their family or pay the rent. And so, I really think that it probably is a completely separate emergency, but I would urge the board to look at, what kind of an emergency should be declared around the economic impact that this is going to have, is having. And so, yeah, I mean, I think that there will need to be rent controls. There will or moratoriums on, people being evicted or having penalties for late payment. Probably the same with mortgages. There's definitely a lot of people in Lane County who are limited or fixed income, and don't have a lot of money saved aside for an emergency such as this. So there is going to be a imperative need to, in all sorts of ways, assist people who have been financially disrupted as well. So that's mainly why I wanted to come in this morning and really just bring the workers into this picture and have someone from the public really come and just speak in perspective of the workers of Lane County. Businesses need their workers to run and operate, and there are a lot of businesses that are going to be so financially impacted by this that they may not be able to reopen. So I understand that there are many moving parts to this, including federal, state, and local responses. But I do appreciate what Commissioner Burney said about how the buck stops in the local realm, and I really do believe that to blunt the effect of this economic impact, the most activity that could be done to blunt that is going to be here at the local level. So I would really urge the board to begin moving right away on an economic emergency declaration as well. Thank you.
Thank you very much. Patrick Jackson is next. Is Patrick Jackson still in the audience? I don't see him. Is there, sorry. Is there anybody else here that wants to speak that hasn't had a chance to speak? Yes, please come to the podium and state your name and district, and I'll give you 3 minutes here. And yes, if you could
my name is
fully spell, I'll write it.
I'll spell my last name.
Thank you.
Hajarizadeh, and I live in Eugene. I don't know my district. I just happened to be coming from court and saw you guys meeting today. So I'll start when the timer starts. I don't want to start before.
Thank you. I was writing down your name.
Thank you.
Feel free.
I'm a public defender here in Lane County, and one of my concerns is about the inmates and the criminal justice system taking people into custody. About 40% of the population in Lane County Jail and in custody in most facilities are high-risk individuals. They either have immune issues, they have some sort of health concerns. I just want to put that on the board's attention. It's the judge's decision whether or not to release someone. However, the law enforcement agencies out there enforcing people, they can get guidance from other individuals. They can take people, they can cite people rather than taking them into custody. That would reduce the amount of people going in and out of jail. They do not need to take people into custody for nonviolent offenses, driving infractions, things of that nature. They have a lot of discretion to do that. Places like Iran released a third of their inmate population over concerns about the COVID-19. So that's just something I want to point out. There's the things that were addressed earlier about the homeless population. A lot of those individuals also end up in custody. They don't get released because they are homeless and they don't have an address to go to. So I just wanted to put that out there because folks who are involved with the justice system usually are not thought of as being a high-risk individual for contracting this, but they are. So I'm putting that out on people's radar. Thank you.
Thank you very much. Anybody else who would like to speak that hasn't had a chance to speak? Okay. I will ask for commissioners if they have any response or remonstrance. If you don't, you can say pass. I'll go in order again. I normally would never go in order like this, but this is a different kind of situation. Commissioner Burney.
Pass.
Commissioner Bozovich.
I'll pass.
Commissioner Farr.
I will pass.
Commissioner Sorensen.
Thank you very much. First of all, I want to thank the people who have come in for public comment. I think that it's very important that the board and staff make it available for the public to be able to comment and to do so without coming into the meetings. So thanks for coming in today until we have a process. And certainly, I'd like to invite the public to email all the commissioners if they have any concerns about the way this emergency is being handled and ideas to improve the county response to it. Also appreciate the concerns about specific populations, and a couple that I think are really worth calling out. The first and foremost is those people who are working or have been working who, because of the emergency, are not going to be able to work. And that includes starting with the people in the food industry who, because of the closure of restaurants and bars, that's an immediate group. But there are many others who I'm sure Mr. Ramirez and our economic folks will be helping to identify where there's hard-hit groups of people where we need to consider using our authority to help those people directly, and either through social service agencies or directly through county authority. Second, I appreciate the specific identification of incarcerated people, particularly those that have low immune abilities, and I really appreciate that being brought to the board's attention. And last but not least, I'll say that I think that we have an opportunity, as well as to do some good through this process. And I want to specifically mention that the long-term bonding rates apparently have been falling along with the stock market over the last week. And I'd like the administrator and others in the hierarchy of the county to, and I know you're doing this anyway, but I just want to highlight that we could refinance some of our debt, perhaps if these low rates are something going on right now. And we could also take advantage of borrowing the money, if we could, under whatever emergency authority we have, to borrow money at low interest rates to be able to use to help the people in our community. And I hope that county administration will examine those opportunities. Thank you very much.
Thank you. Appreciate you both for coming and speaking, and we are working on ways in which we can get public comment here, either via email, which is our biggest call out, and if there's any way to do it by telephone. We're looking into those things. Regarding the court system, we have had a representative from the DA's office and the sheriff in our incident command team discussions. I expect something from the Court Justice Center shortly about procedures. I know they're all in discussion, and again, can't move fast enough for how rapidly this is rolling out. So thank you both for coming. I'm going to move to our consent calendar. Is there a motion to approve the consent calendar as presented?
So moved.
Is there a second?
Second.
Okay. Motion moved by Commissioner Burney, second by Commissioner Bozovich. Any discussion? Hearing none, I'll ask for a vote. All those in favor say aye.
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 All those opposed say nay. Motion passes unanimously. We'll move to item number 7, which is a Public Works item. It's the first reading and setting the second reading and public hearing for ordinance 20-01 in the matter of amending Lane Code Chapter 11 to update definitions, modernizing terminology, amend the code in light of recent changes to state law, and updating referenced codes and statutes. So we have with us Keir Miller, our Director of Planning. If you could introduce your guests and we can move this one through. Thank you.
Thank you, Chair Buck. Good morning, Board of Commissioners. I'd just like to present Alyssa Baz. She's a new plans examiner in our building program, and she's doing a great job working on our Lane Code Chapter 11 updates, and she's just here to announce the first reading.
Thank you.
Thank you. So we have Ordinance 2001 in the matter of amending Lane Code Chapter 11 to update definitions, modernize terminology, amend the code in light of recent changes to state law, and update reference codes and statutes.
Anything else you want to present before we go to the commissioners?
No, this is just a straightforward first reading and announcement of the second reading public hearing.
So in this, just for clarification, the options are to approve as presented and no further readings, or to have amendments and do a second reading?
Well, right now, for a first reading, you just want to, unless the board has any clarifications, approve the first reading and set the second
At
reading.
the second reading, right? Okay. And is there any particular date for second readings?
March 31st is the date set proposed for the second reading.
Is there a time, March 31st? Usually it's at 1:30?
1:30, yes.
Okay. Okay, any questions from commissioners or comments for our presenters? I'll go.
I'm
Commissioner
ready to move approval.
Oh, Commissioner Sorensen.
I move approval of the first reading and setting the second reading and public hearing for March 31 at 1:30 p.m.
Is there a second?
Second.
Okay, we have a motion to approve from Commissioner Sorensen, second by Commissioner Burney. We'll move to discussion. Commissioner Burney, you can also say pass if you don't have anything.
Am I allowed to pass, but maybe reconsider before we're through?
I can come back to you.
Thank you very much.
Commissioner Bozovich.
So my only question is March 31st is still within the window of limited gatherings, and we're proposing a public hearing on a change to code. I am okay with passing the motion right now, but I'm a little bit concerned we won't have in place the technology or the ability for folks to participate in a public hearing by March 31st.
Valid concern. Kier.
Commissioner Bozovich, that's a valid concern. My understanding is that staff are working on ways to do some sort of mobile hearing broadcast where perhaps folks can log in to provide testimony. I'm not sure exactly how it's going to work at this point, though. So we could certainly entertain pushing this out further to a second reading further down the line to provide more time to set that technology up.
Well, I'll leave that up to staff to make that recommendation. We can also come back on the 31st and continue the hearing to a date where we can get that set up.
That would actually probably be a good idea, just in terms of any prior noticing, and folks are aware that this potentially was going to be heard on the 31st, so we could just do a read and roll at that point.
Great. Commissioner Farr.
I have none, thank you.
Commissioner Sorensen.
Yeah, I think that in light of the emergency going on, that we ought to go ahead with the hearing on the 31st. And staff, I'm sure, will be doing all that they can to figure out a way to either have emails sent in or actual live testimony, as well as in-person testimony. And then rather than read and roll, I think we should have the hearing take place and then roll the hearing for continued hearing. That'll solve the publication expense problems, and it will also give additional opportunity for public comment following our hearing. And that seems like a good way to go. And if there's anyone listening to this broadcast and meeting, I would certainly encourage people whose businesses are affected by this to email not only Mr. Miller, but also the Board of Commissioners, so that the perspectives that might otherwise have some difficulty getting through to us will be highlighting that we are inviting that testimony. Thank you very much.
Commissioner Burney?
No, nothing at this time.
Okay. Well, we have a motion on the floor to approve the first reading and setting the second reading for March 31st at 1:30 p.m. If there's no further discussion, I'll ask for the vote. All those in favor say aye. Aye.
Aye.
Aye.
Aye.
All those opposed say nay. Motion passes unanimously. Thank you very much.
Thank you.
Thank you.
We'll move on to Human Resources. Item 8A, Order 20-03-17-05, in the matter of adopting an annual performance review process for employees who report directly to the Board of Commissioners. And with us is Alana Holmes, our HR Director, and you can proceed when you're ready.
Thank you, Chair Buck, Commissioners. Good morning. With me today, I have Erin Rollins. She was with us when we met with you a few months ago on this topic. So the purpose of us being here today is to follow up on that previous discussion regarding performance reviews for board employees. And what we're hoping for today is approval of a process, format, and timeline for the performance reviews for those employees who do report to the Board of Commissioners. I'm going to have Erin provide a quick highlight recap of the comments that we heard and kind of the overall general themes that we heard from the last session and what our recommendations are, and then turn it back over to you, Chair. Erin?
All right. Good morning, Chair Buck and Commissioners. My name is Erin Rollins, and I work for Human Resources doing training and organizational development work. So today we would like to just do a high-level review of the process and point out the places where your feedback was incorporated. So Human Resources recommends that we conduct the annual reviews to remain in alignment with the review processes for all county employees. We also recommend adjusting the timing of the reviews based on our fiscal year calendar to allow the review to be completed 60 days prior to contract review date. For the county administrator, that would change the review period to July 1st to June 30th. For the county council, change the review period from August 1st to July 31st. And for any newly hired board employee, the dates would be set based on the date of hire. There would be a self-assessment component. The board employee will complete a self-assessment and return that to the board for their review. The self-assessment should also include draft goals for the coming year at your suggestion so that the board and board employee can begin the goal-setting discussion for the coming year. For the 360-degree feedback section, the employee prepares their list of names for the 360 survey and shares those names with each commissioner. The list should include all direct reports, if applicable, and other participants familiar with the employee's work, such as other key staff within the county, outside partners, staff from other jurisdictions if relevant, and key constituents and stakeholders. Board members and the employee will have a conversation about any suggestions for additional names and will arrive at a mutually agreed upon list, also based upon your feedback. If the board and the employee cannot mutually agree on a particular name or group of names, the board will retain the final decision authority based on your majority vote. Human Resources will then produce an executive summary of the ratings and key trends from the 360 feedback to provide to the board for their review. Each commissioner reviews the self-assessment information, the 360 feedback, and the employee's performance related to their goals and responsibilities. The board then conducts a discussion with the employee and the HR director in executive session to arrive at the overall performance rating using the data provided. The board and board employee will begin the discussion of goals for the upcoming year as well. The board comes out into public session to summarize the performance evaluation and award a merit increase if applicable. At the next available board meeting, a board order will be prepared to document the performance of the employee and the performance rating. It will also document any merit increases if awarded. The board employee and the board will then finalize and document the goals for the following year. The board employee and board should meet periodically throughout the year to discuss progress towards goals, share feedback, and make any adjustments as necessary. We are asking that you adopt the draft board order, which implements the performance review process as outlined in the board packet, and direct the HR director to work with county council and the county administrator to update employment contracts to reflect the adopted process in time for implementation for the 2020 performance reviews, as well as replicate for any future board employee. Human Resources will create a timeline for each board employee and distribute it to employees and the board. Human Resources will reach out as time approaches to kick off each review process per the timeline. We would now like to ask if there are any questions.
Thank you very much. So if it still works, I'll call on people in the same order. If anybody has adjustments to that or other suggestions, please let me know. I'm trying to work this out as we go here in this situation. So Commissioner Burney. Commissioner Burney, any questions or comments?
Sorry, I just laid out an eloquent question, but I was unmuted. No, I'm just kidding. Yes, could I've looked at all this material. Could the presenters concisely identify the difference between what occurred last year and what they're proposing?
Yes, so the process for the 360 review is more further defined in terms of the board employees selecting the names and then sharing the names with each of the commissioners and implementing the process should there be a disagreement about names or groups of names on the 360 survey. So that part is more refined, as well as implementing that step if there isn't consensus about names. So we have that vote process in place. Also adding, really highlighting the board employees to come forward with proposed goals for the coming year and to really highlight that goal setting discussion happening in order to set up the coming year performance period and reviews.
Chair, excuse me, Vice Chair. I'd like to just add to that. So another area that was highlighted, and this was definitely based on a lot of conversation with the board, was adjusting the timing of the reviews so that we can make sure that they are completed in their entirety at least 60 days prior to contract renewal, because that was something that wasn't happening as we just happened to rotate through or if we push things back. So that is a focus of making sure that every component of an employee's review is done so that assessment can be made with the window prior to the next, to the contract.
And if I don't have it, excuse me, I don't have it in front of me, but if memory serves, in the material, there was one county that did this with 120-day in front of any decision. Is that correct? Do I remember that correctly?
There's a 120-day.
I'm just here. I can probably find it if you want me to.
Yeah, we're looking, Vice Chair, we're looking through the packet. That doesn't necessarily ring a bell with me in this moment.
Okay.
120.
It was when you were reviewing what different counties, comparative counties, how they approached this.
Yes, there was one of the comparator counties where the evaluations are conducted at least 120 days prior to the annual compensation review and adjustment, which parties agree to occur on July 1st each year.
Okay. By the way, I shouldn't say this, but I have to say to Ms. Holmes, given the camera angle when people are presenting to the board, you were right behind it. And I just want to comment on how busy you are working and texting and just taking care of multiple tasks at any given point. That's a compliment.
I will take it as such. Thank you.
It is meant as such. Speaking only for myself, one thing I don't like about this recommendation, it makes sense. I mean, it's a logical process. Is in the event, I was concerned with the opaqueness of the process last year, and if you recall, as a first-year commissioner, I had no idea that only staff were identifying who was going to complete the 360 recommendation. And I also, as I recollect, really had no idea that the key comments that were identified in an assessment that came from the 360 recommendation really were such a small sample. And so I felt that I really wasn't getting full information. So as it relates to this, for what it's worth, I'd like to see maybe even a little more advance time, maybe from 60 to 90 days, so that if there are disagreements or any issues, there's time to resolve these. I mean, these are the two employees that are really the face of the operation to all the program areas and many of our partners and publics. So it just seems that I didn't like the idea that if there were any people that the board and the person being evaluated had to agree on names to go out. I think sometimes minority opinion is the most important opinion, and I would hate to see a political process for controlling input in place as opposed to any board member that has heard from either a constituent or is aware that there might be other opinions out there to invite those. We can always qualify those, or even the employee can qualify those based upon experiences. So that was maybe a minor point, but one of the points I wanted to delve into. And I'd also at some point like to discuss how that sort of executive summary of feedback is presented to the board so we have a better understanding of where it came from and what it really represents. Those are my initial comments. I applaud moving forward with this and that you've done this. This is not critical. This is just my contribution to the discussion.
Thank you. Commissioner Bozievich.
Thank you. I believe that the recommendations that have been put forward are really reasonable changes to the process, and I support the recommendations from staff.
Thank you. Commissioner Farr.
No further comment. Thank you.
Commissioner Sorensen.
Thank you. I support the recommendations, and I agree with Commissioner Burney about the improving the access to information about who is providing the feedback on any particular employee. Thank you.
Thank you. I want to appreciate the time HR took to research this. When we brought it up last year, all the issues and questions I had have been fully vetted through this new recommendation. I'm pleased with it. I am fine with 60 days. I'm also fine, with 60 to 90 days, as Commissioner Burney was interested in. I think otherwise the order looks very good. I appreciate that. I'm getting some notes from staff. So it looks like under HR for this particular item, I'm just sorry, I'm pausing here for a moment because I'm getting messages from Diana regarding the actual board order. And I think she's settled that there is a board order, actually. You've got it in your hand. Okay, very good, because I think the issue was attachment online at the moment. Thank you very much.
Chair, we thought you might need a copy just in case, so.
Yes, and because this involves our two main employees, and I'm not necessarily seeing the board order attached online, I think what I'll do is I'll read it out for the commissioners so they know what we have and can make a motion accordingly. So this is.
Commissioner Buck?
Yes, Diana.
Sorry, it's Diana.
Please.
I just wanted to clarify, sorry, I'm on a bit of a time delay. We do have a board order. It just was not attached in the document I was sent. So the board order was in previous material.
Very good. So I'll read it real quick for everybody so we all know what we're voting on.
Thank you.
Order number 20-03-17-05 in the matter of adopting annual performance review process for employees who report directly to the Board of County Commissioners. Whereas Lane County believes that its employees are the organization's best assets, and whereas it is also the county's belief that all employees deserve to have a balanced and meaningful annual review, and whereas it is the role of the Human Resources to oversee the performance review process for all Lane County employees, and whereas employees that report to the Board of County Commissioners are required to be provided an annual performance review from the board as outlined in their employment agreements. Now, therefore, the Board of County Commissioners of Lane County orders as follows. Number one, adoption of the performance review process for employees who report directly to the Board of County Commissioners as outlined in the board packet. 2, the Director of Human Resources will work with the County Council and County Administrator to update employment contracts to reflect the adoption process in time for implementation for the 2020 performance reviews and replicate for any future board employees. 3, HR, or Human Resources, will document the approved process and create a timeline for each board employee to distribute to the employees and the board. Human Resources will reach out as the time approaches to kick off each review process per the timeline with adoption and signature below. At this time, I'll entertain a motion to approve as written.
So moved.
Is there a second?
Second.
I'm sorry, second.
Okay, motion approved by, motion made by Commissioner Bozievich, second by Commissioner Farr. Any discussion? Commissioner?
Yes.
Oh, Commissioner Sorensen, I'll go with you first.
Yeah, just a suggestion, you might want to alter and rotate the way you started, so it's.
Sure, let's go backwards this time.
It's just okay. One way is, the way they do it in the legislature is they have a list in the sequence, but then they start with the person who was second in the sequence. Just an idea.
Sure, did you have any comments or discussion about this motion?
Yeah, does it include the 90 days the way Commissioner Burney had suggested?
I believe it says 60 days at the moment.
Okay. I'll just make a motion to change 60 to 90.
Is there a second?
Second.
Is that considered a friendly, Commissioner Bozievich, who made the motion?
Yes.
I guess my question would be for staff, is that a problem for staff to make that change to 90 days from 60? And with the timing of when things like budget adoption, et cetera, happens?
Chair, Commissioner Bozievich, This is Alana. Actually, I think for the county administrator, that might be where there's a little bit of a pinch point in that, you know, we are trying to get through the budget process, and then his review comes after that. So if we're moving it,
Could we say 60-90 days, 62 90 days? Would that help that particular item?
where there's flexibility, and if we can make that through the timelines that would match up, then we would be willing to do so. You understand?
Yeah, I'm trying not to comment on this because obviously but I just, from a practical matter, I'm trying to think about, because historically, in the time I've been here, I felt really strongly that my review should come after the budget process because it's one of the really significant roles of the administrator. And so how do you evaluate that person without having gone through the latest budget process? The budget process really happens from early to mid-May and sort of into the end of May, right? The third week of May. So if you back up, even 60 days would be early May, right? 90 days would be April. So that's the challenge, is, you know, receiving feedback from people and then who are asked to evaluate, at least in part, on a process that's a significant part of the role that has not yet been completed.
So in this particular case, if I read this right, it would change your particular review to July 1st to June 30th. So 60 days, you'd have June and May. So May 1st would be the beginning. So 90 would be April, and
I'm saying even 60 days, we haven't, by May 1st, the board, we have not launched the budget. We haven't presented the budget to the budget committee, and we haven't gone through that process,
So Commissioner Bozievich, I'm going to toss this back to you, whether you want to add that. Just for clarification, I'm not seeing in the actual board order that 60 or 90 days is specifically stated. However, it's the procedures that they will be following. Did you have something to add to that, Ms. Rollins?
Yes, on the last page of the board packet is a timeline, and that might be helpful for the conversation. So for the county administrator, we have his review period being July through the end of June, with the 360 feedback window happening during the following July, the review being presented sometime in August, and we would be adjusting the contract renewal dates to actually be on November 1st. So it allows basically the month of September and October to be that 60-day notice period. So there's two 60-day periods here, and I just want to clarify, because the 360 period in July and the August review time is a 60-day period to basically do the 360s, review the information, craft the review, have the performance conversation. And then there's the 60-day period from the time that that conversation is done and performance is documented to when the contract renewal date is. So are we talking about extending that contract renewal date to 90 days, or are you wanting 90 days to complete the performance review process? In which case, if the bulk of the budget processes in terms of the county administrator is in May, and in June really is just the adoption portion of the process, we could have the 360s potentially starting in June, going into July, and have that review section, be maybe mid-July into August, then giving a total of 90 days for 360 and performance conversations. So we could bump the 360 back a bit and still be able to get everything done and have the 60-day notice period and everything, if that makes sense.
Chair?
Hold on. I just want to acknowledge Commissioner Bozievich, and then I'll call on you, Commissioner Burney, real quick.
So with that explanation and the fact that the time periods are not mentioned in the board order, I'm not so happy with the idea of a friendly amendment at this time.
Commissioner Burney.
Oh, I was just going to say, as I understand, thank you very much for that time frame. For me, as I understand it, that alleviates my concern.
Seconder, I withdraw my approval based upon the maker of the motion's lack of approval.
Okay. So we're back.
I'll withdraw. Hey, Chair, I'll withdraw the motion.
Okay, very good. So we're back to the original motion by Commissioner Bozievich. Is there any other discussion? I'll go in reverse order to Commissioner Farr.
None, thank you.
Commissioner Bozievich?
None.
Commissioner Berney?
None, thank you.
And none for me. So at this point, we have a motion on the floor to approve Order 20-03-17-05 as presented. With no further discussion, I'll call for the vote. All those in favor say aye. Aye.
Aye.
All those opposed say nay. Motion passes unanimously. We'll move on. Thank you very much.
Thank you, Chair.
We'll move on to County Council announcements. I don't believe there are any, but in case he walks in, we'll come back. Right now, we'll go to item 10A, County Administration announcements.
Thank you, Chair. And I'd like to just use this time to give an update, kind of an overview, as I promised I would earlier today, on how we're handling workplace changes, business hours of operation, services to the public, and impacts to employees. So I'll sort of walk through some of that, if that's all right, and then answer questions that commissioners may have. We are providing daily emails to employees, and so we sent out a notification on Friday with a number of frequently asked questions and information and changes to policies for employees. We followed up yesterday with another email and additional changes. I think as we've talked about and everyone appreciates, this situation continues to evolve, and as changes at the federal and state level continue to happen, we are adjusting daily as well. And so I want to recognize the challenge that this presents and the stress and frustration I think that many of our employees, as well as residents and families throughout our community, continue to face because there's so much uncertainty in how we're going to handle this. And I'll just maybe reiterate some of the comments that the chair made this morning about, we are one organization and one community, and no one person has all of the answers to how to handle these situations, but working together, we can get through this. I think it's important to mention that Lane County is not a small and isolated business. We are a large, complex, diverse set of unique operations and services provided to the community. And so the way in which we operate at our various facilities and work groups is unique. And so one of the things that we have led with in our response efforts is to say, here's some general parameters that I'll walk through, but we're asking our elected and appointed department heads and managers and staff within each of the work groups to really work together to identify the solutions that best meet the business needs within those work groups, both the people that they serve and the way that they function and operate there. This won't be effective if we have directives, sort of broad, sweeping directives that come from the top, because that's not reflective of the fact that each of our parts are unique. So with that understanding of the diversity of services and operations and the unique aspects of our various work sites and operations, some of the things that we have put out to our employees, and I'll walk through a few, we're finalizing today, and this again will change day by day, changes to public-facing services. So as I said earlier, Lane County continues to be open for business because we have critical services we have to provide to the community, but we're working to adjust the way in which we deliver services and we operate to keep our employees and the public safe. As much as possible, we're identifying where we can be closing front counter operations to public access so that we're not having the public and our staff come in contact and keeping both the public and staff safe. So many of our front counter operations will be closed or limited for direct access, physical access for the public, but we are providing phone numbers and emails and online access for people. So that's one way in which we are seeking to adjust our business operations. I want to encourage both our employees to continue to communicate with their supervisors and management on any of those changes, as well as the public to check online or to call ahead before they may choose to come down for a service. To call ahead, because phone lines will be open. In many cases, hotlines for various functions are being made available. And so the best way to reach staff and to seek services for the time being is to call ahead or to look online. We are also increasing the cleaning of public buildings, and so we've hired some additional staff, extra help staff, to do additional cleanings in high-touch areas to make sure that things like door handles and elevator buttons and railings are cleaned routinely. So that is a measure that's being put into place. Specifically, a lot of requests have come in from our employees for telework, and we have already and continue to implement telework or telecommuting options wherever that is possible. We have a temporary telework request form that we've made available to employees and ask that they fill that out and seek those opportunities with their supervisors and management. We are prioritizing the eligibility of telework based on employees with high risk factors, those who are already set up with remote access because they can be quickly deployed to work to do telework, and the ability to actually conduct your work remotely, as well as other considerations. It's important to note that we have approximately 1,600 employees in Lane County. And so not all 1,600 of those employees can do their work from home. For example, we have deputies, law enforcement officers working in our corrections facility or in the field. We have road workers that are, their work is conducted largely in the field. Facility and park maintenance workers, healthcare workers, as we run 6 community health centers. So some services, and we're trying to do as much as possible from a telecommuting perspective, and others that will need to be provided directly. So this will be a phased approach based on the considerations that I mentioned. It also requires access to varying technology needs and capabilities. We're seeking to stagger shifts, stagger both on-site and remote shifts, so that as much as possible, we're creating social distancing at work by having as many people work from home for a period of time and then shifting that. So some people can come and work on-site and others will work remotely. This will allow us to increase physical working space separation or social distancing. We are restricting all non-essential in-person meetings and encouraging that meetings are conducted via teleconference, as we're doing here today, wherever possible. We are canceling or rescheduling all non-essential, and in most cases that will be all advisory committee meetings. And again, staggering work hours and pursuing alternative work schedules. So that generally addresses, and we're going to continue to put together those, and we're working actively on, I will mention, for example, I've been in communication with our Health and Human Services Department and our community health centers, both staff, providers at the front line, and management, who are understandably concerned about both treating patients who are sick and coming in, as well as the ability to create social distancing within our clinics. Our teams in Health and Human Services, and in this case the clinics, are actively working on implementing telemedicine protocols, so ways in which we can provide patient care virtually. And so those measures are actively being worked on and put into place. Then we're also, Commissioner Farr mentioned the Concern-related employees that are either fall into high-risk categories or maybe sick themselves. So these could be individuals over 60 or 65 who have underlying medical and health issues, or may have the flu, the cold, or potentially concerned that they have coronavirus. We have waived our leave without pay policies to allow that as a resource for employees who may have expired all of their time management that's available. And then we're further not only evaluating the changes that may be coming at the federal and state level related to leaves, but also looking at what can we do to provide flexible options for leave. I'll first say that Lane County, thankfully, we have an incredible employee paid leave program, and we call it time management. What it really is a combination. It combines both sick leave and vacation leave into one large pot of flexible leave time for employees. Many organizations will have vacation time is separate from sick time. We combine all of that and then provide a large amount of it to employees to be able to use either or for vacation or sick leave. So we're very fortunate that as Lane County public employees, we have access to employees each have access to large pool of sick and vacation time with which they can use, and we're allowing that to be used during this time for anyone who wants to be able to schedule that time as well as continue to provide the services that we use. We're also looking at considerations for anyone who may have expired their time management and considering ways in which, to Commissioner Farr's point, and I know is a concern for other commissioners and employees as well, that our employees are not in a situation where they're if they're in a high-risk category, they're having to stay home without pay. So those things are under consideration, and we are working with our union leaders and department staff to identify solutions there. I mentioned the coding on time cards so that we're tracking our time related to the response of the incident. We have an intranet site as well as an internet site that is exclusive for county employees to identify or to review all of this information and options that are available to them. Again, we will provide daily calls or daily emails to employees as this information continues to become available. I'll just make a note on some changes. To give you an example, this will not be a comprehensive list because I know that the commissioners want time to talk and it will take too long to go through all of this. We will be providing today a public news release with all changes as of today to county operations. As an example of the type of changes we're making, the customer service center at the Delta campus is closed to public access. Assessment and taxation front counter is closed for public for front counter access, although the self-help kiosks, self-help computers at the front counter there are available for the public to come in and utilize. So many of these front counter type operations, and these exist in all of our departments, are being or will be closed or limited. But phone numbers are available for people to call, and online services will continue to be available. So I'm happy to answer questions about specific service changes. I mentioned in the healthcare arena for mental health and clinical services, how we're seeking to implement those. And so I think that covers everything. I want to just end here with Commissioner Burney made a comment about shooting in the dark, and it's caused me to reflect on this. And I think that's an accurate point. One of my favorite quotes has been, before all of this happened, about sort of our human condition, is by a British author and journalist who said, Oliver Burkeman, who said, one of the most fundamental yet still underappreciated truths of human existence is this: everyone is totally just winging it all of the time. So that was a true statement before we entered into this global pandemic, and I think that what we're dealing with now heightens our awareness of the reality that we're all doing the best that we can, and we're all winging it, every day here. And I want to encourage for us as an organization that it's a great opportunity. We've talked a little bit about failing forward, the idea of, let's take some risk, calculated risks. Let's create a culture of learning where we embrace a risk-taking and failure and learn from that. And this is a good opportunity for us to work together. And so I really want to encourage employees to work with their supervisors and managers to come up with solutions, creative ideas in which we can continue to deliver service to the community and vulnerable populations, but also make sure that our employees are safe and healthy throughout this pandemic. I will not have all the solutions. Our directors and managers will not have all the solutions. Commissioners will not have all the solutions. And employees will not have all the solutions. But together, we can work on coming up with creative and innovative ideas and solutions that keep all of us safe and healthy. So I'll stop there, and I'm happy to answer any questions the board may have.
Thank you, Mr. Mokryski. I will follow Commissioner Sorensen's suggestion and go backwards in calls for comments. Commissioner Sorensen.
I don't know what else the county could do to increase the availability of testing, but I believe that we are flying blind without getting mass testing. And I believe that other governments, whether they're in less developed nations or developed nations, have recognized that and are undertaking mass testing. I don't know how they are getting test kits and laboratory analysis faster than we are, but to the extent that Lane County government has anything to do with this failure, I'm not interested in blaming people. I'm interested in getting the testing and would encourage the staff to do whatever they can to advocate for that. I am certainly doing that with the governor and the congressional delegation, but I think we need to have a serious attempt to get the testing. We really are putting out false information to the state and the country when we say there are no confirmed COVID-19 cases, when it may be true legally that a case has not been confirmed, but in fact we are in the middle of a global pandemic, and we need to get the testing in our area as soon as possible. Thank you.
I would just briefly say to Commissioner Sorensen, I, along with our public health officials and emergency operations staff that spoke earlier, we're in agreement about the lack of testing availability currently and our frustration with that. I would say that, and just reiterate again, because I think it's really important that during these times of uncertainty, we really focus on the facts of what we know. And what we know is, and this is not to shift responsibility, but really to say Lane County has a critical role in terms of local public health response, but we have no direct control over testing capabilities. Those are made both through the federal and state governments, through the federal government, the CDC, and then these private labs that are being stood up. It is true that the reporting, even on the confirmation of tests that have been completed, and in Lane County, we don't have any confirmed or presumptive cases based on the tests that have been completed. We know that there are more tests that have been submitted for analysis that we're not aware of, because the clinics are not required, the private clinics are not required to tell Lane County Public Health when they submit a test, but we do get a notification after a test is completed. So we do know that of all completed tests, as of 4 p.m. yesterday, we had no confirmed cases, but I think you've heard everybody say that we fully expect we will have confirmed cases, and we don't, I think we would acknowledge that it's likely that the virus exists in the community. So we're doing the best that we can with the capabilities that are available to us, and I would encourage commissioners, as you are, Commissioner Sorensen, and I know others are, to continue to advocate at the state and federal level for as much access to state and federal testing and private lab testing.
Commissioner Farr.
Thank you, Chair Buck. I'm going to respond with a couple of quotes, as I often do, and my words are always the best when I'm actually repeating the words of professionals who have stated them and allowed me to repeat them. I do hear people who are concerned about the lack of testing. And I heard a couple of comments today that I'm going to be able to repeat. The first one was by Dr. Ludke. We have 4 labs able to provide testing. The data we have so far from China and more from Europe is that more than 80% of all cases are asymptomatic, and there's very little testing needed. Significantly lower than the general public may think, but more than we have in terms of number of tests. If broad spread identification is made of people who test positive, then what do we do about it? We don't have the capability of diverting resources from other medical needs into this. So the number of tests that we have available, I'm off the quote right now, really are comparable to the number that we can respond to. The second quote that I have is from Ms. Gaffney, and that was a little later on in the meeting where she said, "We share your concern that there is not the amount of testing that we want either. Capacity to provide the kits is not something local authority has. We want to make sure that with the capacity we have, the people who need it the most are the ones who get it. It may not be that anyone who wants a test anytime will be able to get the test." And the final thing that I'll say, and this is from Mr. Mokrahajski, and it's not regarding testing, it's regarding the situation in general. I have witnessed a very aggressive and dynamic action by the staff of Lane County that changes every single day. As I read the messages that we publicly put out every day, there are changes, there are updates, and there are improvements. Mr. Mokrahajski, you said, I think that everyone appreciates that this is a very fluid situation that is changing day by day. I agree, and that is where I hang up my hat. Thank you very much.
Thank you. Commissioner Bozievich.
Thank you. And I agree with Dr. Lutke's assessment about testing. I think the most important thing we can do is stress the need for personal hygiene, staying home if you're sick, and social distancing. As a board, I think that's the messages we need to clearly get out there. It's about preventing the spread. There's going to be cases in Lane County and across the state, and broad testing isn't going to change that, but social distancing, personal hygiene, and staying home if you're sick will. So, but I wanted to get back to the announcements here and note and ask the question. The construction industry is one of the few industries where there is almost natural social distancing, often in open air, performed with PPE on and gloves quite often. And I hear that our permit counter is closing. Is there provisions to try and keep permits and inspections moving for the construction industry, particularly when we are, besides the fact that we're in this COVID-19 crisis right now, we were already in a housing crisis. So could you address that maybe, and is there going to be an attempt to try and at least keep that industry moving forward so we don't have to have an economic recovery for that too?
Yes, Chair Buck and Commissioner Bozievich, we, as I mentioned, what we're trying to do, again, this is a balancing act because we want to keep the public and our employees safe. And so given the fact that our customer service center at Delta is one of several county operations where large numbers of people gather to seek services, and those people need to seek the services, but the problem right now is we're creating a public health risk by doing that in the way that it has historically been done. So we're seeking to do that in a different way. Services will continue to be provided. We are taking care to evaluate from a building inspection standpoint. This is also true as it relates to our property appraisers who go out onto properties and inside of buildings. I think primarily the concern right now is, coming into contact, both our staff going into whether it's residences or commercial facilities, that could create exposure either for the public or for those employees. So those are the things that we're considering adjustments to the way in which those types of services are provided, but we will continue to process, to respond to requests for information and services online and over the phone, particularly as it relates to building permits and other planning measures.
Any other comments, Commissioner Bozievich?
Thank you. I appreciate that. I do believe that, most of the construction inspections are visual, and, if there is need to enter a space, a house that's under construction or whatever, usually, a little bit of precaution about, like I said, social distancing, maybe some hand protection in the form of gloves so you're not touching surfaces. But I think we can accommodate and maintain that industry through this crisis, because we need to try and keep as much going as we can while making sure our workers stay safe.
Yeah, I'll just agree with that statement.
Commissioner Berney.
Well, first off, great point, Jay. I really appreciate both Commissioner Bozievich's insight there and Mr. Mokrahajski's response. I believe, let me just share a story in terms of how this is impacting us. My wife was going to be having our granddaughter over tonight because school is closed and her parents work. Her father came home with 101 fever yesterday, and consequently, we, as a high-risk people, have to be quarantined from our granddaughter. And her mother is reducing hours immediately because she works in the food service industry. So it just, it just layers upon layers upon layers, where obviously this is a temporary social distancing thing, but it is so, so important. And frankly, it's very difficult for us. And I just wanted to personalize this a bit, but now I'd like to speak to several things. Mr. Mokrahajski mentioned my comment, kind of like flying blind. I'd like to say that I said that in the context, and I think all of our service and public health providers would agree that until we have massively more testing and the ability to identify those affected, those not, and to provide the appropriate treatment as quickly as possible for those affected. That's what I was referring to. I agree with Steve. All of humanity, we are always flying blind. I would also like to remind him that I shared with him another fact, which is that airline pilots often, over 99% of the time, are flying off course. So your airline from Chicago to Eugene, as long as United still provides that service, is flying off course 99% of the time. And software is constantly adjusting and readjusting so that when we land at the right concourse, at the right airport, to get into and can get home. So flying blind isn't a condemnation. It's a fact. And maybe flying, that's a bad quote. But it is the support system that I hear that's being put in place. It's the collaboration and passion and commitment from staff and from community groups and from individuals that are making incredibly good opinion suggestions and offers, that in fact we're constantly making that mid-course correction, which is going to allow us to land this experience back to normalcy. So I don't like it when comments are taken out of context. I needed to explain that. I believe every crisis, and we've all lived through personal and social crises in our lives, also creates opportunity. And every period of disinvestment is a period of reinvestment. So the opportunities I see here, which I think Mr. Mokrehajski identified, Steve, I totally love your philosophy and approach to this stuff. You know that. Is that we also have opportunities to see how the county can coordinate, support, encourage, facilitate business to business, neighbor to neighbor, community group to community group help, because we are creating here a supplementary new infrastructure for our community's resiliency that I think will last beyond this crisis. So kudos to you all, and those are my final comments.
Chair, is it okay if I just make a brief comment? Thank you. And Commissioner Berney, this is the challenge with the remoteness of our communications. And I want to say I appreciated your comment about shooting in the dark. I think it was very accurate, and it's good to call that out. And so, my comments were intended to say, to just embellish on that this is true. We all are, and it's okay that we're all adjusting in the moment, So I'm glad that you made that statement. I want to, if it's all right, a couple other brief insertions here I'd like to offer, because a couple of commissioners have expressed, and I know all of you have expressed concerns about things like evictions and economic impacts to residents. We had Commissioner Bozovich who reached out to the assessor and asked about property tax penalty waivers. I know that the assessor is now actively working with our state partners to see, are there ways in which we can get some waivers to allow a state waiver to allow us to waive penalties on late payments for property tax. So I just want to, that's one thing. We received a communication from Homes for Good, and they are, I know, actively working to not pursue evictions unless it's the most egregious situation that for health and safety an individual has to be. So, and we know that there's state and federal legislation that's being considered around that as well. And then finally, Commissioner Sorensen brought up a point earlier that I just want to circle back to around low interest rates and borrowing money. And I think that's a good point that we are monitoring, and we have financial advisors that are looking into, where there are opportunities for us to refinance existing debt. We've done a lot of that in recent years. And if the interest rates are beneficial and the cost to refinance allows us to do that to save taxpayers' resources going forward, we absolutely will consider it. One thing we're looking at is we've been actively working on this PERS side account. One of my concerns has been the timing of our investment in that side account, because the money goes into the market, and if we're investing it when the market is at a peak, that can be challenging. We're now seeing that it may be a better time for us. And this is important in the context of long-term, how we manage our public resources and recover from all of the impacts of that. So we're looking at the timing of all those. And I would just say, as a general comment about borrowing money, anytime we think about borrowing money, we have to be sure that we have a revenue source to pay it back. So certainly there's always money to be borrowed in the market. And when interest rates are low, that can be a favorable time to go borrow money for certain things. But the fundamental issue is we have to have the existing revenue to be able to pay that debt off. So the extent to which there's not revenue available for us to pay off debt that we would borrow, we're not going to be able to just go borrow money in the market to spend it on things. But the general point about pursuing the opportunity to limit economic impacts and manage our own resources through lower interest rates in the market in the current environment, we absolutely are, and we'll continue to monitor that.
Very good. I'm going to move on to Commissioners' business announcements. Are there any Commissioner announcements? I'll just have you.
Yes.
Commissioner Sorensen.
I just wanted to say that I wanted to commend the Association of Oregon Counties for their vigilant efforts to provide statewide conference calls with the Oregon Health Authority, the Governor's Office, and other people that are involved in this state and local emergency. I thought their briefings have been pretty helpful in understanding the extent of the problem and ideas for solving the problem. And I would just commend that I know I heard Jay and Joe on the phone call on Friday. I don't know who else was on it, but I think that these AOC phone calls are very valuable, and I've been in touch with the new AOC executive director, who I've known for over 25 years, and she is going to continue to arrange those kind of calls.
Thank you. Any other announcements? Hearing none?
This is Jay.
Oh, Jay. Commissioner Bozievich.
And then me after you.
Got it.
Yeah. So real quick, I skipped over remonstrance today to try and get us to our business items and get through things to get staff back to work. But I just want to say that this has been a really impactful time for all of our citizens. You know, I know as a business owner with my wife, we had to make a decision over the weekend on canceling a tour she runs in England and France this coming spring in May. And we had to spend the day yesterday telephoning the people that had signed up and made deposits and talking to them about their options. We're rescheduling the tour for the fall, hopefully. So I really get the impact this is having on people, but I just want to say as my announcement that this really is not something that was cooked up to damage the economy. It's not a partisan issue. It is a public health crisis of world proportions. If folks need information to understand that, they can contact me and I can provide links to papers that kind of make people understand why we're doing what we're doing in this state, this county, in this country, to try and do the social distancing and get people to protect themselves with personal hygiene, and to try to prevent the spread of this disease, because it does have a higher mortality rate than the flu. And it does put people in the ICU, which is a limited resource in this country. And if we don't flatten the curve, we exceed our medical capacities and we get an even higher mortality rate than would normally be. So I just want to reiterate again, this is a completely nonpartisan issue. Everybody should be working together to get past this. At the same time, we should be thinking about our neighbors. And, one of the concerns early on when I brought up the idea of discontinuing a lot of senior services and all that was the issue of social isolation for seniors. So I'm just encouraging folks also reach out and call someone you know that might be a little bit more isolated, and just make that contact by voice at least. And if you have the ability to do it by FaceTime, that'd be great. But take a minute to call somebody that maybe isn't getting the visitors they used to get, and try and prevent that social isolation. So thank you for letting me have a moment.
Thank you, Commissioner Bozievich. Very good ideas and things for us to work on together to get through this. Commissioner Berney.
Yeah, +1 on Commissioner Bozievich's comments. I just wanted to also, after Commissioner Sorensen's statement about the new AOC director, I want to share with everyone that the new AOC director has a special place in her heart for Lane County. She was born and initially raised in Springfield. She graduated from the school my wife taught at for 30 years, Cottage Grove High School. She has a fascinating background in mental health, and much of her thinking she shared with me was guided by one of my mentors, and I'm absolutely delighted and looking forward to working with her. I think the Lane County Board of Commissioners has a very strong ally in the new leadership at AOC. I just simply wanted to mention that.
Thank you. Anything to add, Commissioner Farr?
Thank you, Chair Buck. Ever so briefly, the coordination of efforts between Lane County, the local nonprofits, and other jurisdictions has been commendable. There were some questions earlier about food insecurity. That is something, of course, that I've thought about for a lot of years, and we are blessed in this county to have Food for Lane County, which coordinates all of the food banks in Lane County. Distributing food. While if you look at their huge warehouse, at any one time they only have about a 2-week supply of food, they also have wide open supply lines. And if any county is equipped to handle it, Lane County, in no small part because of Food for Lane County, is equipped to handle food shortages and food supply disruptions. Beyond that, Mr. Mokrzycki, once again, congratulations on the staff work that is taking place. This is very fluid, and it does change daily, and you are adapting wonderfully from my observation. It wouldn't have been able to do this 7 years ago before we achieved a level of financial stability that has been recognized by Moody's and others. We'd be in much worse shape if we weren't as stable as we are and as well organized as we are on the financial basis. So once again, my thanks to all of staff who are putting in extra hours, boots on the ground, getting us through this temporary emergency that we're in. And as has been stated, it will pass.
Thank you. And we'll move on to future board assignment requests. Any future board assignment requests you can call out? Commissioner Sorensen.
This is Pete. Yeah, thank you. I would like to request that we have a item on our future agendas that is the global pandemic update, so that the staff that's involved with that will get a specific time certain, and that the county administrator and county council will be available for questions, and then we'll make that a specific item until the completion of the emergency.
Any other future board assignment requests? Don't hear any. So we have one ask of an update, and we won't be back for 2 weeks, and a lot will happen between now and then, and I'm sure we'll be updated along the way. I would agree that we'll need a decent update in 2 weeks as well, especially for the public who's watching. So we'll go to review of assignments. Before I do that, actually, I want to make sure that we have 3 head nods for the pandemic update on some routine basis until we're through the emergency. I'm a head nod. Commissioner Sorensen, anybody else?
Affirmative.
Both head nod.
Very good. Okay, we'll go to review of assignments.
So I just have that assignment that we'll have a standing item on future board meetings. I think a time certain makes sense so that we can have staff here and be efficient with that regarding the local response to the COVID-19 global pandemic.
Very good. There's no executive session for today. That has been suspended for another time. Any other business? If anybody has any other business, feel free to call out. Hearing none, I want to thank the commissioners for being so steadfast and keeping up to date with everything that's happening here at the county. If there's ever a time for us to come together, it is now for the greater good of our community. I will remain here at the county as long as I physically possibly can. I appreciate all your presence via email, social media, etc. And again, we'll get through this. Meeting is adjourned.